heart attacks in the young people is reaching an epidemic proportion nowadays. Since my return from UK in 2009, I am increasingly operating on patients younger than me in the age group of 35 to 40. And sometimes when I operate on these patients, I don't even have a neat artery to do my bypass grafting. And I have to do what we call as endarterectomy. The prognosis of the patients in this age group who have had a heart attack requiring angioplasty or surgery is not very good. And lucky are these patients who are able to reach the doorsteps of hospitals. Many of these people are having sudden heart attack and sudden cardiac death. That young celebrities, young gymnasts and actors are dying while either exercising or performing on the stage or even while walking. What are the reasons for onset of heart disease in the young adults? It is early onset of diabetes, early onset of hypertension, and high cholesterol because of unregulated eating habits. Another important cause in modern society is unregulated sleep patterns, going to sleep very late in the night and getting up late. Our system produces a hormone called melatonin, which is a reparative hormone which eases your body and soothes the body. It is produced between 10 p.m. and midnight. So my recommendation, which is an age-old saying, that early to bed, early to rise makes a person healthy, wealthy and wise. So this looks like a very simple remedy, but mind you friends, if you do not sleep well, your body is not getting enough rest to recuperate. And another thing, what we say is how we regulate our ahar and vihar. Ahar is not even what you take to your mouth. Whatever you are taking through your panchendriyas is ahar. So regulated eating patterns, regulated whatever you do has to be in regulation. And vihar is what? How you recreate. Early morning get up, yoga, pranayam, spending time with nature and regular exercise is very, very important. Another important cause of heart disease in the young people is people who have got a family history of heart disease. What does it mean? Any parents or first siblings who have had a heart attack at a young age, so those people are at a high risk. People are going for smoking or other sorts of hookah and other things. These people are also at a high risk. Passive smoking, and they have found an increased incidence of heart disease in the cab driver, even noise pollution and excessive intake of alcohol are also causes of heart disease. So what is the remedy for us? We have to start early, drive slowly and reach safely, as what Bhagwan Sri Satya Sai Baba used to say. So we need to teach even our children, because the atherosclerotic process which leads to blockages in coronary artery disease starts at a very young age. So what are the symptoms that somebody is having a heart disease? Any chest pain which is above diaphragm, any pain which in the either of the arms, or even the pain radiating to the chin, it can be because of the heart disease. Do not neglect it to be because of acidity. Take prompt attention. Do not self-diagnose yourself. Visit a nearest cardiac center. Get the relevant test advised by the cardiologist and get yourself treated. But our intention is not to reach to that stage. Our intention is to modify the risk factors. If you have diabetes and hypertension, keep them under control with proper medication and lifestyle modification, so you do not reach a stage of getting a premature coronary artery disease leading to sudden heart attack in the young and sudden cardiac death. So this is my sincere request to the people to not to think that this is a mythical story that people are getting heart attack at the young age. It's a glaring reality, and we as a society need to wake up to this, because all these people who are getting heart attack at the young age, they are in a breadwinning stage. What will happen to the family? Because once you get angioplasty or cardiac surgery at a young age, mentally a person is crippled. We are seeing a lot of episodes of psychological disturbances post cardiac interventions. So I request all the corporate society leaders, even the governmental organization, to bring a culture of the health of their employees, especially the cardiac health, and do regular screening, regular programs for young people to empower themselves for prevention of heart disease in the young people. India is a young nation and 50% of our people are less than 40 years. So if we safeguard the health of these people, we will become a stronger, healthier and a prosperous nation.